In this week's episode, 5 of our specialists team up to straighten the spine of an 8-month-old French Bulldog with kyphosis. Here's how it all went down.
Insane.
Yeah.
Look at his little scoot! Oh my god!
So Teddy is an 8-month-old French Bulldog who came to Guardian a little over a week ago for progressive weakness in the hind limbs. We admitted him to try to evaluate the cause of the weakness and ended up doing both an MRI and a CAT scan of his spine. The CAT scan really shows the condition best, and he had some x-rays as well, which were abnormal. So unfortunately, true to his breed, many of these French Bulldogs have spinal malformations that they're born with. And there are variable degrees of the malformation. And so if we look here at his CAT scan, we can see that this is his spine here. And it's got almost a 90-degree kink in it, right here in the thoracic spine. The spine really should be straight like this all throughout. And because of this kink in his spine, that's causing compression of his spinal cord, and it's disrupting the signals to his back legs, which is why he's not walking normally. The owners reported that he had been getting progressively weaker over the past several months, and they've had him since he was about 2 months old. And so what we're going to do today is attempt to straighten out his spine. We're going to do an approach that's through the chest, called a thoracotomy, and Dr. Runge, our soft tissue surgeon, is going to help us with that. He's actually getting started with the approach now. And then once that's done, once these bones are all cleared off, we're going to go in and put some screws in there and also use an instrument called a distractor to try to spread the bones apart and straighten out the spine. Once we've got it straightened to our satisfaction, we'll fix it with titanium bars. And then after that, we'll drill away this kink here that's causing the spinal cord to be compressed. The hope is that over the next several weeks, he'll get some function back. Now, currently he is able to walk, but he is very ataxic, meaning unsteady, and paretic, meaning weak in the back legs. So we hope that over the next several weeks after surgery, he'll be less ataxic, less paretic, and get stronger and steadier in those back legs. It's important to try to do this kind of right now. He's a puppy, and so his bones are hopefully mature enough to be able to receive an implant, but not too mature that when we try to change the shape of his vertebrae, that he'll be able to grow in a way that's a bit more normal than what we're seeing on his CT scan.
Hi everybody, I'm Dr. Jeff Runge. I'm the board-certified minimally invasive surgeon that's here at Guardian Veterinary Specialist. And I was able to assist Dr. Gibson today in one of her neurological procedures that was requiring us to enter the thoracic cavity. There have been some reports of people treating kyphosis by approaching the thoracic cavity and trying to basically straighten out the vertebral column. And since I have the ability to approach that surgical area for Dr. Gibson, she had enlisted my help in getting herself to the surgical field to enable that portion of the procedure that she needed to do. So I had performed a lateral thoracotomy for her, and to do this, what we typically do is put the patient in lateral recumbency, and I'll make an approach based upon the location of the lesion associated with the spinal cord. So this is a picture here, or an x-ray of Teddy, and you can see what we're looking at is Teddy on his side, and this is his chest cavity. His heart is situated right here, and this is actually his vertebral column. And one of the things that's very outstanding here is you can see this curve in this dog's back. This location right here, this little hump, if you will, is the area that actually was the necessary region we had to get to. It is situated over the thorax, which means basically they needed me to get them into the chest. The location of this requires me to kind of make a surgical incision between the ribs and enter into the chest cavity on the left side and actually bring down the aorta dissect some of the vessels that are coming off the aorta and the azygos vein that are feeding the ribs, and give them a surgical space that they can work in to put their hardware to straighten the spine out. So we did that before they started their procedure, and this particular patient required a little bit of a clean off of the tissue that's surrounding these particular bones right here. So once I get into the thoracic cavity, I begin to remove the fascia, some of the tendons, and the vasculature that is potentially going to get in their way. Once I have that, I let the team do their neurological procedure. Then I'll come in afterwards to ensure that there is no hemorrhage that's happening, clean the surgical site up, and then also close the thoracic cavity to ensure that we have the ability to recover. So the patient now is exiting the operating room, is going to recover in ICU with our ICU clinicians and our overnight team, and our hope is to see a comfortable dog tomorrow. Immediately upon exiting the operating room, they will get a CT scan to ensure that the hardware is placed properly, and if at any point I have to go enter, they will tell me again and we'll reopen the thoracic cavity.
So surgery went quite well. I'm very happy with it. We got a lot of exposure of the vertebrae as we were hoping. It was always a challenge with these dogs with their abnormal spines, but we were able to get our screws and our bar appropriately placed, and also distracting, so pushing the spine apart a little bit to try to straighten it out. So he'll have a chest tube now because we were in his chest, and we want to make sure that we evacuate any air or fluid that may build up in there as he heals over the next few days. He'll stay in the ICU for at least 3 days for post-op care. And then it's a matter of time, so hoping that over the next several weeks he improves in terms of his walking, or at least maintains what he's got, because he was getting worse. So we're all pretty pleased with how he's doing. After they finish closing, we're going to do a post-op CAT scan to check the placement of all the pins, but it all went really well. So Teddy came in for a recheck today, and I couldn't be happier with how he looks. He still has some deficits when he's walking, so his legs will kind of splay out, and he can't predict where he's going to place his feet, so that's called ataxia, so he's still a little ataxic as well. However, his paw placement has improved when we're checking his kind of spatial awareness of his feet. It's called proprioception. The owners report that at home he's able to stand when he's eating his meals, and they think he's getting around a lot better than previously. So it's been a couple weeks, and I was hoping that we'd see some improvement over these 6 to 8 weeks post-op. The fact that we're seeing some improvement at 2 weeks is just thrilling. I couldn't be happier about him. I can't wait to see him again. He'll be back in about a month.